Words matter. And when you're living with MS, many words can be complex, confusing, and even scary at times. But learning more about the words we use when we're talking about MS can be empowering. Staying in the know can help people be accurate when they describe their MS and be proactive in their care. Let's learn more together. Welcome to this edition of Wise Up Words and Why They Matter. I'm John Strum, and joining me for today's conversation is Dr. Jiwon Oh. Dr. Oh is a neurologist, scientist, and the medical director of the Barlo Multiple Sclerosis Program at St. Michael's Hospital in Ontario, Canada. Thanks for joining us today, Dr. Oh.
Thanks for having me, John. It's a pleasure to be here.
When I think about someone being diagnosed with MS, and I think of words that matter, one word that comes to mind is early. Why is getting an early and accurate MS diagnosis so important?
Well, I think we in MS we have the benefit of having had a number of studies where many people have been followed over time, and in the field, we've seen some really dramatic changes in terms of treatment in the last 2 decades. And so, because of that, we have a lot of scientific evidence that's accumulated demonstrating how important it is to first of all, diagnose MS as early as possible, and then in appropriate patients to start treatment as early as possible. And, in the early days when treatments first became available, people didn't know this, but now that we actually have 20 plus years of evidence where we've seen the difference that early treatment makes, it's pretty clear that this should be the standard of care. And so this is why there's such an emphasis these days on, first of all, recognizing the symptoms of MS and then getting a prompt diagnosis.
Another word often associated with MS is the word chronic. What does it mean if someone is diagnosed with a chronic health condition?
Well, so to me, and I think in the medical field, probably chronic means a number of things, but I would say it means something that doesn't just go away, something that stays with you. It's a very applicable term to a disease like MS, where again, it's not something with a kind of pre-specified duration. It's something that's there, something that kind of fluctuates over time, but something that is always there when people receive a diagnosis for many decades, if not a lifetime.
Language and the words we use also become important when you consider the conversations that are centered around an individual's care. The best treatment plan is one that results from direct, clear communication between a patient and their physician. How do you encourage those conversations in the clinic?
I think everybody has probably a different style as to how they approach these things. But one thing I think we've recognized in the field is um, how limited our neurological tools are in the clinic when we're trying to evaluate how people are doing neurologically, and specifically to monitor in a chronic disease like MS. Neurological changes over time. In any neurologist's office, you'll see the tools that we usually use, which are, vision charts. We have tuning forks, we have reflex hammers. We test strength and all of these things, but it's so clear that these tools are limited and actually don't have the ability to pick up on subtle changes that people with MS are experiencing. So because of this, I think questions that neurologists ask are so important in terms of monitoring how people are doing. And so the way I generally approach this is to ask pretty open-ended questions initially. And I ask people living with MS how they're doing in general, if they feel like they're doing as well as they were the year before, or if they feel like things have gotten worse. If things have gotten worse, I ask them to describe it and specifically what they've noticed has changed and how this has affected different parts of their life. So whether it's, family life or professional life or other things, I'll ask kind of for specific examples. And then, depending on a patient's personality, sometimes they're more forthcoming with symptoms and sometimes they're not. And so if they aren't, sometimes I actually go through a checklist of different possible symptoms that people can have. And then I'll ask just general questions like, Do you get out of the house as much as you used to? Are you able to see your friends? Are you able to do all of the things that you want to? Things like that. And I'll often start the conversation off also by asking, what's the one thing that's bothering you the most? And what's the one thing that you wanted for sure to talk about when you saw me today? So those are, some examples of some of the questions that I'll ask, just to try to get an idea of what's on people's minds, and from a general kind of neurological functioning standpoint, how people are actually doing. Because again, the tools that we use to try to objectively measure how people are doing neurologically are so limited.
Technology and innovation are driving the pace of scientific discovery at a rate that we've really never seen before. In fact, the National MS Society reminds us that we've seen as many advances in MS research in the past 5 years as we have in the previous 70 years. How have you seen innovation impact MS care?
So, I'm sure this is the case for many of my colleagues and contemporaries, but for me, it's been eye-opening being in this field, because I think of every kind of training epoch that I had going through medicine. So I remember being in the as a medical student, being in the MS clinic in Toronto, which was, one of the larger clinics in Canada. At the time, MRI was not as easily accessible. And so it was really used as a tool for diagnosis. But the way we monitor people using MRI, because there is so much clinically silent disease activity that tools like MRI can detect. And again, we now know this because we have the scientific evidence to prove it. But at the time, we didn't. So we really didn't use MRI regularly in clinical practice. And then I remember after residency, when I started my MS fellowship, this was when literally every year or two, there would be new treatments approved. But now there's this whole range of over 20 treatments where, depending on someone's disease activity, their personal preference, their lifestyle, whether they want to get pregnant in the next couple of years, there's so much choice. And so it's just completely changed in front of my eyes. And so I've kind of lived through all of that change. So it's been really interesting to see how dramatically different everything is, as a practicing MS neurologist now, compared to what it was like at every kind of single stage of training that I went through.
Although it isn't a new phenomenon, we seem to be hearing more about persistent hidden neuroinflammation. Can you connect the dots between that hidden inflammation and MS disease progression?
Sure. So, I think this is a phenomenon that probably most people living with MS definitely knew about, and many neurologists probably suspected, but it's only been in recent years that we've really focused on it, because I think we now have access to many therapies that are considered very high efficacy therapies, and they, virtually in many people get rid of any clinical relapses or new MRI lesions. Yet, in many people, you still notice this slow kind of grumbling, progressive worsening of many different neurological symptoms. And, this is, again, it's kind of a reflection of the fact that there's been so much development in the field that we've been able to kind of get a handle on some of the relapse disease biology with some of these newer treatments. But now, what's actually becoming more apparent and front and center is this kind of chronic progression that's still there, even when you're using some of these really high efficacy treatments that are, again, really good at dealing with relapse disease biology. And so the field has realized that this is the huge unmet need that we have in terms of treatment. And this is the real unmet need that we have in terms of needing to understand what causes it. And so, fortunately, there's a lot of research happening in this area, and we do understand that there is chronic inflammation, likely confined within the central nervous system, that is responsible for driving this slow progression that you see, even when there are no acute relapses or new MRI lesions forming. And many people actually refer to this clinical phenomenon that we observe as PIRA, or progression that is independent of relapse activity. And so this is probably the new beast that we need to tackle. And I think it's important that we're recognizing how common Pura is. And even early in the disease course, when you ask people the right questions, they will notice these symptoms of Pura. And so I think we're just at the beginning of starting to understand the many different processes that are responsible for it. And hopefully that understanding will allow us to develop treatments that are effective at reducing Pura, because unfortunately, despite the fact that we have nearly 25 different treatments for MS, most of them are targeted at the relapse disease biology, and that's a great thing. It's not to say that we didn't need to get a handle on. It's just that unfortunately, many of the treatments probably don't have a huge effect on the disease mechanisms responsible for Pura. And so hopefully this is what we'll be able to tackle as a field in the coming years.
This series is all about words and why they matter. So, what one word comes to mind when you think about the future of MS treatment?
It's always hard to just choose one word. Um, but I would say prevention is one word that comes to mind. Just kind of getting to the earliest possible kind of treatment stage of MS. And then if I can, John, another one that comes to mind is tailored. So again, I think there's a challenge that we have in clinical practice. Sometimes having so many treatments makes things really complicated. And I think in the future, we'll have a better way to tailor treatment to the exact individual person living with MS in front of us. And that is a way that we're going to be able to hopefully kind of maximize treatment outcomes and minimize the negative impact of MS in general.
Well, Dr. Jiwon Oh, thanks for helping us wise up to the words you use, both as a neurologist treating MS patients and as a scientist working to create next generation MS therapies.
Thank you for having me, John. It's always a pleasure.